Hi, thanks for joining us on our presentation. Um, our presentation that we decided to research was on opioid addiction. So our group members here are Emily, Acacia, Emma, Mariah, and Fabian. So to start off the bat, we're going to talk about what are opioids. Opioids are a type of medication. Our definition here comes from the Mayo Clinic website from 2018, and um, opioids are basically a pain relieving drug that interacts with the opioid receptors in your cells. And it can be made from the poppy plant, so like morphine, and there's a couple other options right here um, that's made from the poppy plant. Or some of them are synthesized in a laboratory, like fentanyl, and there's a couple others mentioned here. Um, so the website talked about when opioid medications travel through your blood and attach to opioid receptors in your brain cells, the cells release signals that muffle your perceptions of pain and boost the feelings of pleasure. And there's also a quote here that says that when used as directed by your doctor, opioid medications safely help control acute pain, like after surgery, but there are risks when the medication is used incorrectly. So it's very important that if a person is taking opioid medications, that they make sure to follow their doctor's prescription and not take that into their own hands. An opioid addiction. So we have our website here, drugabuse.gov, and the definition here says that all opioids are chemically related and interact with opioid receptors on nerve cells in the body and brain. Opioid pain relievers are generally safe when taken for a short time, but as prescribed by a doctor. Um, but because they produce euphoria in addition to pain relief, they can be misused and taken in a different way or larger quantity than prescribed, or taken without doctor's prescription. Regular use can, even as prescribed by a doctor, can lead to dependence, and when misused, opioid pain relievers can lead to addiction, overdose incidents, and deaths. So obviously, opioids are very addictive because of the way that um, they like are received by your cells, and so your brain interprets it. And so it's not only a pain reliever, but it says here they produce euphoria in addition to the pain relief, and that just adds to the highly addictive quality in opioids. So opioid addiction treatment, there's a couple different types of treatment available for opioid addiction. So it says here, opioid addicts often cannot work through their addictions alone. These addictions, they need to change the following things. So a lot of it is behavior, attitude and mindset, and also environment. This can be incredibly challenging for one person to work through alone, so it's no wonder that opioid addicts do not often stop cold turkey. The most common way to go about opioid treatment is to use medication assisted treatment. So this is where a medication helps reduce the side effects of the opioids and stop the craving that might lead to a relapse. The medications help the addict recover their normal state of mind, and other helpful treatments can include education, counseling, whatever other support might be needed in that situation, because it is a very tough situation, and when you're so addicted, you can't just quit and be done. It is something that takes like a lot of time to work through and get past it. So here's a couple different types of treatments that are available. So methadone is the standard form of medication assisted treatment. It's only available through federally regulated clinics, and these are unfortunately highly unappealing to addicts. It improves physical and mental health. It decreases mortality from addiction. It blocks effects from other opioids, and it reduces the craving. Another treatment available is naltrexone, which is an opioid blocker. This blocks the euphoric feeling and pain relieving from most opioids. It's not addictive, no tolerance development. Disadvantages of this, though, is it doesn't suppress withdrawals or cravings. leading to a lack of motivation to take it on a regular basis. It cannot be started until the patient is opioid free for 2 weeks, which can be very difficult since opioids are so highly addicting. If relapse occurs, there's a risk of death from overdose as well. And the last one here is buprenorphine. I'm not sure how you pronounce that, but you can read it right here, the last one here. This one suppresses withdrawal symptoms and cravings. It does not cause euphoria, blocks opioid effects for 24 hours. Participation in federal program is not required, low abuse potential, and there's the two common forms, which is Suboxone and Subtext. Risks of buprenorphine treatment. So the first one is the most common side effect is constipation, mild to severe. Another common side effect is hypogonadism, which results in lowered level of testosterone, loss of energy and sexual desire. Coming off this medication too soon or abruptly can result in withdrawal. Taking this medication on top of regular opiate medication can also result in withdrawal. It can result in various medical complications, and if the patient is suffering from pain, it won't have an impact or won't solve the problem if taken within 24 hours of Suboxone. So, implications and recommendations. Medication-assisted treatment can allow one to regain a normal state of mind, for example, free from withdrawal, craving, and drug-induced highs and lows of addiction. Using medication-assisted treatment is similar to using medication to treat other chronic illnesses such as heart disease, asthma, or diabetes. Taking medication for opioid addiction is not the same as substituting one addictive drug for another addictive drug. When taken properly, medication-assisted treatment, it reduces opioid withdrawal, reduces cravings, and blocks the effects of the other problem. It's safe to take buprenorphine if you have a feeling of withdrawal. Worldly principles on opioid addiction. It can be the biggest challenges of someone's life. They start with good intentions of healing pain, but then get addicted. They can have a good life and a good family and still get addicted. And it can happen when you don't take the doctor's warning seriously. Advantages and disadvantages of the treatment. It suppresses withdrawal. It blocks the effects of other opioids. Does not cause euphoria. 1 year sober has been reported high, 40 to 60% in some studies. Its abuse potential is substantially lower than methadone. Disadvantages: without supplementing normal levels of brain chemicals with drugs, you feel sick, constipation, loss of energy, loss of sexual desire. Our recommendation and biblical worldview. So I have a verse here. They promise them freedom, but they themselves are slaves of corruption. For whatever overcomes a person, to that he is enslaved. Addiction is more than just a physical battle. It's a spiritual and moral and psychological battle. And so, from our perspective, it is important to find help. There are obviously a lot of options for this, and one of the biggest ones that you can find in research is just the medication-assisted option, but also there are lots of places where you can receive counseling, education, more of the emotional help to help change the lifestyle and behavior that we kind of talked about at the beginning of the presentation. And yeah, so here are our sources. We have from Mayo Clinic, our website with some information about that, and 2 videos as well that have some information that we used in the presentation. So thanks for watching, and I hope you learned something.